start with, follicular unit extraction, which is what FUE stands for, is a technique of hair transplant that takes one graft at a time from the donor area where the hair is permanent, typically at the back and the sides of the head, and moves it to wherever you need it. When you do a follicular unit extraction procedure, your results are dependent on how many grafts you get. Manual follicular unit extraction will typically result in about 300 to 500 grafts. And a powered FUE procedure, something that uses a little handheld motor to assist the doctor in getting those grafts for you, will typically result in about somewhere between 1,000 and 1,500 grafts. I myself have, I've had a couple of cases go up to almost 1,800 or 1,900 grafts, but it depends on the person's individual head. So that's what FUE is. Now, how is that scarless? When you take a single hair or a single follicular unit from the back of the head, these little sites where the hair is removed from are typically about 1 millimeter or less, sometimes a little tiny bit larger, but usually 1 millimeter is the standard in diameter. So like a little dot, if you were to take a pen and just dink, a little dot like that. You end up with several thousand of these all over your head. So that initially it looks like a bunch of little red dots, but those heal because they're so tiny. They heal very quickly. They usually heal within 3 to 5 days, and the scar that results from this is minuscule. I usually tell people that you're probably not going to be able to see the scar unless you decide to join the Marines, shave your head with a Bic razor, and get a tan at the same time. And then you'll probably see little dots because the scars themselves will not tan. So that's why follicular unit extraction is considered scarless. Now, traditional hair transplant surgery has evolved to the point where you can get some scars on the back of people's heads that are completely invisible. Even though linear scars still occur, they're usually between 1 and 2 millimeters at the worst. And they typically have hair growing through them if the surgeon has done what's called a trichophytic incision. So you can be pretty well assured that if you shave your head anything above a number 3 on a pair of clippers, that you're not going to see that scar. The main problem that you run into is with people who want to wear the hair really, really short. If you want to wear your hair buzz short below a 3, or you want to Bic your hair, although, if you really want to make your hair that short, why are you getting a hair transplant? But if you really want to Bic your hair absolutely short, then the follicular unit extraction procedure is for you. Typically, a lot of actors will choose that. Anybody who has shaved their head in the past and wants to maintain that ability to, one day just go ahead and shave their head and not have anybody kind of question what is that big scar on the back of your head. But like I said, there's not really big scars in this industry anymore. For people who do it routinely and who are experienced, both methods of transplantation are almost equivalent in their ability to hide the scar. So there you go. Hello, I'm Dr. Sara Wasserbauer, and I'm here to answer your question on how is an FUE procedure scarless. To begin with, let me explain that a follicular unit extraction, or an FUE procedure, is different from a traditional hair restoration procedure in that it takes out the grafts from your donor area one at a time. And when you do that, you leave usually a tiny little scar or a tiny little hole. That hole is about 1 millimeter in diameter. So, if you were to take a pen and just kind of do a little dot, that's about the size that it is. There are these little dot scars all over your donor area, but because they're so tiny and so diffusely spaced, they don't draw your eye the way that a traditional strip hair surgery scar would, which would be a line. Your eye is trained to see lines and angles, and it is not necessarily trained to recognize diffuse patterns. So that's why it is much more difficult to see all those little tiny dot scars. And the way that I usually tell my patients that you'd be best able to see it is if my patient decides to shave their head, go get a tan, then you wouldn't be able to see those little white scars wouldn't tan, and the skin around them probably would. So that would be the best way to see that. So it's not completely scarless, but the scar is very difficult to see. Now, that being said, if you're somebody who really wants to maintain the ability to shave their head, the follicular unit extraction procedure is really the gold standard. But if you're somebody who is looking for as many grafts as you can possibly get at a time, while still minimizing the scar burden on the back of your head, well, a traditional hair surgery would do that for you. Trichophytic incisions are beautiful. They end up with maybe 1 millimeter or 2 scar in most cases. Hair grows through the scar, and you can shave your head probably down to about a number 3 in my experience. On a set of clippers, the number on the side, if you shave to about a number 3, you probably will not see any scars. If you shave below that, then you might want to consider a follicular unit extraction. But scars with traditional surgeries these days are beautiful, really well done. So that's the main difference in scarring between a follicular unit extraction procedure and a traditional procedure.